Hello, this is Dr. Janson. So what are the symptoms of heel pain? Heel pain is pain in your heel, usually one foot, sometimes it's two. And the worst thing is waking up in the morning and it's very painful to put your foot down on the ground. Also, you can have pain, and then after a while it goes away a little bit, but then after a while with a lot of walking, the heel pain can come back. So it's a sharp pain in the morning, but in the afternoon with a lot of walking, it becomes a dull, achy pain. And it's a toothache type of pain that just doesn't go away. And it's hard to make heel pain go away. And most patients that see me have already seen a lot of doctors. They've seen physical therapists, so they've been given exercises. They use ice, they go online, and they do stretches, and they buy themselves a night splint, and nothing seems to work. So that's a typical patient of mine has seen 2 or 3 doctors, so that may be true with you too. Okay, so let's talk about what causes heel pain. So first I'd like to talk to you anatomically about what causes heel pain. So I'd like to show you my skeleton here. This is real human bone. And this is the heel bone. And you can see that it's quite prominent, and it's easy for it to have too much pressure on it. So part of it is the shape of the heel bone, that it's, a pointy part of your body, and all your weight goes down on there. So it's easy for this to get injured. There's also a mechanical problem. This piece of tape that I'm going to put on back here, this represents your Achilles tendon. And the Achilles tendon comes from the calf muscle, like this. I'm just going to bend my tape a little bit so it looks like a round tendon. So it looks something like this. And then it goes up into the calf muscle, that's in your leg. So it attaches back here. So you could think of the heel bone sort of as a clothesline pulley. And this is a rope that's going around the pulley. You see, and as the calf muscle tightens up, it's going to pull up on this heel bone. And I call it a clothesline pulley because the back of the heel bone is round. You see what I mean? That part is round. The part that hits the ground is round. And then another anatomical aspect of the problem is the plantar fascia. And plantar means bottom, and fascia means ligament. So you can think of like an ankle ligament sprain. So this is a ligament, and it's on the bottom of your foot. And it's a really big ligament. It's the biggest ligament in your body, actually. And this ligament attaches from the heel bone to the ball of your foot. You see how I put the tape there like that? And your foot is in arch, like the arch of a bridge. And this strut, you could see, holds up the arch. Can you see that? I hope that's clear. And then what happens is if you have tension on this band or tension on this band, the heel bone can become painful because the bone gets injured, because the tissue is pulling off the bone a little bit. Now, if this band on the bottom is inflamed, that's called plantar fasciitis. If this is inflamed, this is called Achilles tendonitis. So if you have pain like at the bottom, it's usually because of the Achilles tendon. If you have pain through the arch, that's because of the plantar fascia. Another problem you can have is you can have a little blister that forms right here, right there where my finger is poking through, a little blister, and that's called a bursal sac. And when it's inflamed, that's called bursitis. So that's another thing that can happen. And then a fourth thing that can happen is you could have some atrophy or thinning of the fat pad under your heel, and that'll make you have bone pain. So those are the 4 things that you could have: Achilles tendonitis, plantar fasciitis, bursitis, or bone pain, heel bone pain, or bone spur. So that's the anatomical explanation of it. Okay, so let's look at, now I showed you the skeleton, but I also would like to show you this picture here. So here's a picture of a foot, and here's the Achilles tendon I was showing you here. They don't really have the plantar fascia in this picture, but it goes here, and this is the heel bone stuck between these 2 things pulling on it. And then this shows a high arch foot, and this shows a flat foot. But in both pictures, you see this arrow shows the grinding of the heel bone. That the ankle, because of the structure of your foot, you could have a flat foot or a high arch foot. One is grinding outwards and the other one is grinding inwards. You see this one's grinding inwards. So because of the biomechanics of your foot, you could have a situation that's prone to heel pain because there's too much tension on the Achilles tendon or on the plantar fascia. And over time, that's going to, cause pain or cause an injury. But what gets it started? The biomechanics you have your entire life. In other words, if you're flat-footed, you've been flat-footed your whole life, but you didn't have heel pain in the past. Why do you have heel pain now? So what can start it is activities can start it. So you join a gym and you begin a jumping yoga class, jumping calisthenic class. Also, becoming too active. The other thing that can happen is you can be too sedentary. So you're sitting around too much and your muscles get really tight. So being sedentary actually can cause it too. Poor shoes, worn out shoes can cause it because you don't have enough support in your shoes. That can get everything aggravated. And another thing that can cause your heel to hurt is weight gain. And it doesn't take much weight gain to begin the heel pain. So, and of course with the pandemic, a lot of people have been sedentary and gaining weight. So this is a double whammy. So I'm seeing a lot of heel pain now. And that's actually why I'm making the video, so that I can help people.